Hi, I'm Gene Bruno. I'm the Dean of Academics for Huntington College of Health Sciences, and I'm here today to talk to you about herbal remedies for colds, flu, and sinusitis. Now, besides the fact that all three of these conditions are upper respiratory infections, what they also have in common is that there are three herbs that are particularly useful in treating them. This includes andrographis, eleuthero, and echinacea. Let's start with andrographis paniculata. Andrographis has a history of use in both traditional Chinese medicine as well as Ayurvedic medicine. Research indicates that it has anti-inflammatory properties as well as immune-stimulating properties. Furthermore, studies have shown that andrographis is very effective in treating the common cold. Some of the effects include reducing the severity of symptoms and reducing the duration of those colds. Another herb, Eleutherococcus senticosus, or just eleuthero, has been used extensively in Russia for many, many generations. Russians used it to treat stress-related illnesses, and they also have used it in Russian medicine to help the treatment of illnesses related to the immune system. In traditional Chinese medicine, this herb was also used. As a matter of fact, it was used to treat colds and flus. Now, the next herb, echinacea, is one you've probably heard about for the treatment of cold and flus. As a matter of fact, there's a great deal of research showing that echinacea is effective at helping to treat and to prevent both of these illnesses. The research suggests that if you already have a cold, you're more likely to get a good effect with echinacea if you start it immediately at the onset of symptoms instead of waiting until you're further into it. Echinacea has great immune-stimulating properties, which explains some of its efficacy in treating colds and flus. So what happens if you combine these herbs together to treat colds, flus, or sinusitis? Well, let's take a look at two studies in which andrographis and eleuthero were used in the treatment of flus. Subjects that were given this particular combinations experienced a much quicker recovery time. Furthermore, when they had the flu, they had less symptoms, less headaches, less muscle pain. And in addition, in these studies, the people that used this combination actually experienced less complications after the flu, which sometimes happens. Now, there was two more studies that were done on andrographis and eleuthero. In this case, it was for the treatment of the common cold, as well as for sore throats. And what they found in this study was, not surprisingly, this combination also reduced the severity of symptoms. In particular, it was really good at helping to reduce the sore throat to the extent that there was 55% less sore throat-related symptoms. And of course, the people recovered more quickly. So how about the common cold? Well, the combination of andrographis and eleuthero were also given to subjects in two different studies for the treatment of the common cold. Not surprisingly, the subjects experienced a reduction in their symptoms, especially in sore throats. They had a 55% reduction in those, and they recovered much more quickly. Another double-blind, placebo-controlled study took this combination of andrographis and eleuthero and tested it in people who had upper respiratory infections, including sinusitis. What they found is that the people with sinusitis, as well as the other respiratory tract infections, had great improvements. The sinusitis symptoms were decreased significantly, and the authors of that particular study concluded that that combination was particularly effective for treating the inflammatory symptoms of sinusitis. Now, since andrographis, eleuthero, and echinacea have all been shown to be effective in treating the cold, the flu, and even sinusitis, why not combine them all together for a better overall effect? Now, my recommendation would be, based on the research, the kind of dose you're looking for andrographis is around 340 milligrams of a standardized extract. Similarly, eleuthero would be about 39 milligrams of a standardized extract, and echinacea would be about 800 milligrams of a standardized extract. It would be best to take that maybe 3 times during the day. Now, this approach is an excellent approach. But it doesn't mean that you can't also use some of the other typical types of remedies, such as extra vitamin C or zinc lozenges. If you combine that together with this approach, I think you're going to find an excellent response next time you're suffering from the cold, flu, and sinusitis. Now, if you're interested in what I've been talking about today, and you'd like to read about it, I've written an article entitled Colds, Flus, and Sinusitis, Herbal Relief, which you can access and download for free at greatearth.com. Just go to the educational literature link, click on that, and from there you'll be able to access the article. Thank you.